Hello, and I'm excited to be here to share my research today. I just like to thank you for allowing me time to really get my information out. So, my why. Why is this important? Why was this important to me? And why did I feel that this was important to actually research? One of the important, my why is because substance use disorder is closer to me than I would like. Just having a parent and several family members who suffered from substance use disorder. Um, and also working in a hospital setting. I'm a licensed clinical social worker. I've worked in a safety net hospital, level 1 trauma center, and day in and day out, I've had to work with and try to access treatment for substance use disorder patients daily. According to SAMHSA, over time it has become extremely difficult to link patients with substance abuse disorders to treatment from hospital settings due to barriers to access. Because substance abuse has historically been viewed as a social and a criminal issue, it has been viewed that preventative health programs were not considered a healthcare system problem. So usually access to programs were not available. Many people with substance use disorder utilize healthcare systems, and I've seen this on a daily basis. They come in for medical reasons, overdoses, mental health issues. That is their primary place that they go for treatment. They're not going to their primary care providers. They're going to go to a hospital. In 2019, more than 20 million people over the age of 12 required treatment for substance use disorder. And so globally, access and the availability to drug treatment services are scarce for individuals. And only 1 out of 8 actually receive the treatment that they need. So knowledge from previous pandemics has revealed that the demand for substance abuse services increased during pandemics. And this has been true since COVID-19. So just a quick overview, what was the problem? Lack of resources was one of them. With the COVID-19 pandemic, we had these social distance protocols, you had massive shutdowns, and so that impeded in substance use patients receiving treatment. Also, 1 out of 5 people on a medical unit have a substance abuse disorder. With this, hospital social workers have the challenge to meet the demand of discharging the most complex patients quickly and avoid high length of stays within the hospital setting. So if they are not able to access treatment, you have compressed emergency rooms, you have higher length of stays within a hospital, and you have higher readmission rates. Readmissions is considered when a patient comes back to the hospital for treatment when they've been discharged less than 30 days from the hospital. So I wanted to explore the barriers of access. The barriers that I looked at was availability of services, referral to treatment wait time, and also a patient's ability to pay. I wanted to address the gap in literature because several studies that I found, according to barriers to access, they were done from the perspective of the addict themselves, from the treatment facility themselves, or from the intake process. But there were no studies from the perspective of hospital social workers where these patients are coming to get their treatment on a daily basis. This will inform practice, research, policy, and implications. The goal was to, at one point, decrease the length of stay, increase readmission rates, and to allow social workers to discharge patients timely to the next level of care. Most importantly, you want to get substance use patients treatment that they need at the time that they're asking, because we all know that if they want treatment, it's important to get it right away, because you don't want them to you don't want to risk them losing the interest in actually getting treatment. It's also important to think about you had 2 competing crises at the same time. You had a drug crisis that hospitals were already being hit with, and then you had a pandemic where hospitals were the front line of defense. So what did I want to know? I wanted to know to what extent then hospital social workers encounter barriers with availability of service, referral wait time, and the patient's ability to pay when accessing treatment for patients with SUD since the COVID-19 pandemic. Being that this was exploratory study, I did not have any hypothesis, and the results were to answer the research questions. So what did the literature state? Literature showed that historically, social workers have been one of the most fundamental service providers for people with SUD, as they deliver frontline service to patients in hospitals and medical facilities. With over 600,000 social work practitioners, nearly half of them work in a hospital setting. They are required to assist with minimizing the duration of the stay, and they are getting dealing with the most complex cases within a hospital setting. Literature also showed that there will be an increasing demand for social workers addressing the healthcare needs in the US. So how did COVID-19 impact treatment? Well, it had a tremendous stress on the healthcare facilities worldwide. Patients with substance use disorder had significantly higher hospital admissions than non-users due to injuries. People with substance use disorder have a higher risk of getting COVID-19 with complications and adverse outcomes. This is including being on ventilators and things like that. So I would be remiss if I did not just mention the inception of hospital social worker, being that it started here in Boston at the Massachusetts General Hospital with Dr. Cabot and Ida Cannon, who was coined the pioneer hospital social work. They saw that there was a need to address the social needs of patients because without addressing those needs, it impacted their ability to receive healthcare. So barriers to treatment. Of course, I stated that I wanted to look at availability of services, wait time, and patients' ability to pay. Most of the literature stated that availability of services was a barrier to treatment, and also stated that the need for treatment has increased, but treatment availability has not met the demand for it. With referral to wait time, wait list for services is frequently identified as the most common challenge for people pursuing care. This is not even including a person who needs detoxification because they have their own separate wait list. You have patients that are waiting 3 to 6 months on a wait list just to get into treatment. On top of that, you have the red tape of referring a patient, going through the multiple phone calls, and the referral process just made it tedious to even get a patient into treatment. When looking at a patient's availability to pay, one of the primary structural barriers to treatment is lack of insurance and the inability to afford the cost. A study by Chen shows that over 50% of substance abusers do not seek treatment due to financial issues. Lastly, I wanted to look historically at policies that were put in place to address substance abuse and how they change. Now, although reviewed a lot of policies, what stood out to me was that none of the policies address barriers to access. And one of the main policies, well, two of them, one was the Affordable Care Act. This put provisions into place to improve SUD care and expand access to treatment. This was allowed for the market exchange for healthcare and that they had to cover substance abuse. However, the problem is that those who were unable to afford insurance through that market, they had to go through Medicaid, which also presented another challenge because one of the issues was identification, not meeting the requirements to receive Medicaid, and even Medicaid didn't cover a lot of treatment. So you still had that problem. Also, the Supreme Court ruling in 2012 allowed states to opt out of the expansion. So if your state didn't opt in, then you still weren't able to receive the coverage for care. So my research design, I did an exploratory descriptive mixed method, which included qualitative and quantitative. Participants were recruited from 3 hospital care systems in the metropolitan Atlanta area. One was a public hospital and 2 were private hospitals. The population was hospital social workers all the way from a bachelor's in social work to licensed clinical social workers with a array of experience from no experience to over 20 years of experience. The instrument that I use, because I could not find an instrument for my study, I created an instrument myself that's specifically for the study to gather the data. The survey contains statements based on perceptions that measured barriers participants experience when accessing treatment for SUD patients. There's about 4 questions on the survey that were open-ended questions that allow the participants to expand on their experience to go a little bit more deeper. So, as we all want to know, what did the results say? What came out of this? What we found out was with availability of services and referral wait time, that was considered a moderate barrier for them. With the survey, it was a Likert scale, so it went from not a barrier to an extreme barrier. And so for availability of services and wait time, they considered that to be a moderate barrier. However, patients' ability to pay, the participants found that to be an extreme barrier to accessing care for the patients. Something that I found actually interesting as well was there was a significance with referral to wait time. So participants without a license perceive referral wait time to be a greater barrier to treatment than participants with a license. And I just found that a little interesting. So when looking at my content analysis, I did a 2 coding process. So I had an overarching theme, which was the parents themes, and then I had child themes that were themes within the overarching theme. And so when I was looking at that, I wanted to know what other ways has COVID-19 impacted your ability to access treatment? And so for this, some of the responses or some of the themes that I got were issues with policy changes, facilities shutting down. They also the availability, like bed availability. That was also something because of COVID-19 and all of the social distance protocols that were put in place, or if someone had COVID-19, then you had to isolate them. So it decreased the number of beds available, which caused a problem. So just some of the statements that I received from some of the participants, COVID-19 has impacted patients' ability to access treatment due to limits on what facilities are allowed to do to the virus. The virus has caused some facilities to not have enough funding to treat patients in a timely manner. The staffing shortages have been amplified and the demand for services continues to rise, which overloads inpatient hospitals. So the other question I wanted to know is what other ways were impacted your attempts to refer the patient? And some of the themes with this one was there was lack of services offered, the requirements for testing patients, fear surrounding COVID-19 was a problem. The knowledge surrounding COVID-19 was an issue, whether they was vaccinated or not. And some of the statements were sadly because of COVID-19, I have had to call treatment programs various times to ensure that patients were properly referred. Most agencies, facilities are not allowing following CDC recommendations. Thus, if a person is COVID recovered past 10 days and without symptoms, they still are not allowed to receive service until negative for COVID. Some locations are requesting 2 negative COVID tests. So when looking at other ways that they seen was a barrier as far as patients' ability to pay, some of the things that came was funding for patients, underlining health concerns, patients' increased use of substances, also just loss of job and wages. And so they lost in insurance coverage. Another thing was loss of coverage and Medicaid. Medicaid had their own backlog of wait lists and processing Medicaid for patients. So they were a lot of times behind 6 months. And the reduction in loss of benefits. And so, due to the loss of wages and insurance coverage, patients do not have the access for treatment as outpatient substance abuse programs charge fees for their services. The population that is served in the ER are uninsured. I recently tried to get someone into inpatient, and they were also turned away, even with Medicaid. Medicaid doesn't cover the entire treatment. And so lastly, I wanted to know what other barriers did they experience outside the barriers that I was looking at. And some of the things that came out of that was funding, transportation issues, technology was an issue because a lot of the facilities went to the telehealth, but if there was patients who did not have access to technology or they wasn't technology savvy, and so that became an issue. Also, resources, there were either no resources or they were outdated. Some other barriers that I found that were very important that was mentioned was the growing demand for mental health services, the absence of a supportive environment for patients leaving the hospital, the inconvenience of operating hours between facilities, also the lack of clear communication between facilities, patients, and hospital social workers, and language barriers. So a statement by one of the participants were the acute medical complex model focuses on the treatment of illness, not behaviors. We've had to redefine the parameters of how we treat patients with SUD in a more holistic and integrated way to address not only the physical manifestation of SUD, but the behaviors involved as well. So what does this mean? Basically, this means that COVID-19 pandemic exacerbated not only pre-existing barriers, but also created more barriers for hospital social workers when attempting to provide services for SUD patients. Other studies that I've seen that post COVID-19 show that with the treatment facilities, they didn't have funding. And so they had to apply for grants just to fund these facilities. So how is this important? This implication for education. We know that social workers are the front lines of care during pandemics, much like COVID-19. And this is important. So programs need to feel that educational programs need to address global crisis in a formal education setting to prepare social workers for when they get in the field and they come across these situations that they're better equipped to handle it. Because this is not the first crisis, this is not the first pandemic, and it won't be the last. It is beneficial to incorporate a healthcare specialization in programs, being that this is a growing profession and we see more social workers entering in the healthcare profession. It would be beneficial to have a master's program with that specialization to prepare them for when they get out there into these healthcare systems. Also, seeing just with my research that licensure was important. Those with licensure didn't find it that difficult, whereas those who were not licensed found it just a little bit more difficult. And so incorporating licensing preparedness and subsidy certifications within the programs, because this is a growing thing. And so they're going to be dealing with substance use disorders more. And so just making sure that they're prepared for that. It's important for practice because the National Association of Social Work Standards of Practice working with SUD clients are advocacy and collaboration. And so it's important that social workers, it is important in working with SUD patients that it is imperative that social workers are able to access services in the community to promote self-advocacy, and that's most important. The inability to access services hinders social workers' ability to effectively care for their patients, and coordination of care is vital for patients discharging from the hospital, and collaboration plays a major role in that. Social workers must partner with multiple disciplines, community organizations, family, and other social work colleagues to minimize the duplication of services, ensuring the SUD patient's care is coordinated and treatment needs are met. This is not, like I said, not the first pandemic, and it won't be the last. When it comes to policy, financial impact with COVID-19 was major. Families lost their jobs, they lost their health care benefits. Recent studies found during COVID-19 there was a lack of federal and state funding for treatment centers, impeding their ability to provide the services needed. Social workers found that insurance did not fully cover the cost of treatment, creating a barrier for those patients unable to cover the cost. So there needs to be some policy changes in healthcare coverage. There needs to be a creation and implementation of plans to address SUD treatment accessibility, importantly during a crisis. Because this has been going on for so long, there needs to be some type of provisions and plans in place to ensure that we're able to treat these patients during this time. I would like to thank you for allowing me the time. And if you have any questions,